Top 10 Dangerous Stroke Signs at Night You Should Know. After my father's stroke, the neurologist said something that still haunts me to this day. The most important warning signs often appear within 24 hours before a stroke actually happens, especially at night. At that moment, I was frozen. Because my father had shown strange signs the night before, we just didn't know they were alarms going off. And sadly, this isn't just something that happened to my family. Most people are familiar with FAST, the classic signs like facial drooping, arm weakness, and slurred speech. But very few realize that before those signs show up, the body often sends earlier signals, quiet, vague, and easy to miss. These often happen at night: unusual insomnia, sudden headaches, an unexplainable wave of exhaustion, brief confusion right after waking, or even a fleeting sense of weakness in one arm or leg just for a few seconds, then gone. No one thinks that could be a stroke warning, but for someone at high risk, it could be the last chance to prevent a tragedy. I wish we had known this sooner. A little knowledge could have changed everything. That's why in the next section, I'll share 5 nighttime warning signs that experts say are most likely to be overlooked before a stroke, especially within the critical 24-hour window. And at the end of the video, I'll tell you what the doctor privately told my family, a simple thing that may help prevent a second stroke. Number 1. Sleep apnea. Millions of Americans, especially those over 60, suffer from sleep apnea. They might think the biggest problem is a groggy morning or an annoyed spouse. But here's the terrifying reality. Each time you stop breathing, your body is starved of oxygen. Your brain panics. It floods your system with stress hormones, causing your blood pressure to skyrocket. Night after night, this turns your arteries into a high-pressure war zone, dramatically increasing the risk of a clot forming that's destined to travel straight to your brain. This isn't just loud snoring, it's a direct, measurable risk factor for a stroke. The bridge to safety? Get tested. A CPAP machine isn't just a device for a better night's sleep, it's a potentially life-saving shield against a stroke. Number 2. Nighttime high blood pressure. Your blood pressure is supposed to take a nightly vacation, dipping by about 10 to 20% while you rest. But for many, that doesn't happen. This condition is called non-dipping, and it's like running a marathon in your sleep. Your cardiovascular system never gets a break, wearing it down and setting the stage for a stroke. Ask your doctor about 24-hour ambulatory blood pressure monitoring. A single reading at the clinic doesn't tell the whole story. What's happening at 2 a.m. is what truly matters.
Number 3. A fluttering feeling in your chest. It can feel like a fish flopping around in your chest, a strange flutter that comes and goes. It's easy to dismiss, but this sensation could be atrial fibrillation, or AFib, stroke's most notorious partner in crime. AFib allows blood to pool in the heart, forming clots. These clots can then travel directly to the brain. That seemingly harmless flutter could be the sound of a ticking clock. If you experience this, even rarely, it's not something to wait and see about. Mention it to your doctor immediately. Recognizing these warning signs is your first line of defense. But what happens when that line is breached and a stroke hits while you sleep? You wake up and feel different. The following signs aren't warnings, they are active emergencies. Number 4. The thunderclap headache. Most of us have had headaches. They come on gradually, maybe from stress, a poor night's sleep, or a long day. We take a pill, we rest, and they fade. But this headache is entirely different. Picture this. One moment you were perfectly fine, the next an explosive, blinding pain hits you like a hammer. Survivors have described it not just as the worst headache of my life, but as feeling like they've been shot or struck by lightning. The pain reaches its absolute peak within seconds to a minute. This pain isn't a symptom of muscle tension or stress. It is the sound of your brain screaming for help. This is the classic sign of a hemorrhagic stroke, often caused by a ruptured aneurysm in the brain. Imagine a water pipe under too much pressure bursting. That explosive pain is the sudden flood of blood putting direct pressure on your highly sensitive brain tissue. It can happen spontaneously, but it can also be triggered by a minor exertion like a cough, a sneeze, or straining on the toilet. Do not take an aspirin, as it can make the bleeding worse. Do not have a family member drive you. Call 911 immediately. Knowing how to distinguish this from a typical migraine could be the difference between life and death. Number 5. A sudden curtain over your vision. As we get older, we get used to changes in our vision. Cataracts, floaters, or simply needing a stronger prescription. We tend to assume that any vision issue starts with the eye itself. But here's a critical shift in thinking you need to make. Sometimes your eye is just the window to your brain's health. You wake up and suddenly part of your vision is just gone, as if someone pulled a gray curtain down over one side. Or maybe you can only see half of the world, or the world suddenly doubles.
Think of your eyes as cameras and your brain as the editing room. The cameras might be perfectly fine, but if the cable to the editing room is cut or the editing room loses power, you get no picture. A stroke can hit the occipital lobe at the back of the brain, which processes all your visual information. When that area is starved of blood, your screen goes dark. The problem isn't in the eye, it's in command central. If you or loved one experiences any sudden, painless vision change, whether it's partial vision loss, double vision, or blurred vision, ask yourself, is anything else going on? With or without other symptoms, treat this as an emergency. Number 6. Distinguishing dizziness from vertigo. I feel a little dizzy is one of the most common complaints among older adults, and it's often dismissed. We blame it on standing up too quickly, a medication side effect, or inner ear issues. And sometimes we're right, but there is a type of dizziness that is in a completely different league. Lightheadedness, dizziness, is a feeling of being woozy or faint, as if you might pass out. But true vertigo is a violent and intense sensation that the world around you, or you yourself, is spinning uncontrollably. The feeling is so severe that you can't stand, you can't walk, and it may be accompanied by nausea and vomiting. This intense spinning is a red flag for a stroke in the cerebellum, the part of the brain at the back of your head responsible for coordinating all of your body's movement, balance, and rhythm. Think of it as your body's motion controller. When it's under attack, your entire balance system collapses. Doctors often look for a cluster of symptoms that accompany the vertigo to identify a stroke in this area. Think of it as a group of clues. If this intense spinning is paired with double vision, slurred speech, trouble swallowing, or a loss of coordination, for example, being unable to touch your finger to your nose, call 911 immediately. When you talk to paramedics, don't just say, "I'm dizzy." Be precise. The whole room is spinning, I can't stand up, and I feel sick to my stomach. Providing a detailed description of the quality of the symptom, not just its name, can be the most critical piece of information that helps doctors diagnose you correctly and save your life. And finally, we have the classic signs. But when they happen the moment you wake up, they feel different and more confusing. Here is how they might appear in those first disorienting moments of your day. Number 7. Face. You shuffle into the bathroom, still shaking off the remnants of sleep, and glance in the mirror. But the person looking back isn't quite you. Your own reflection betrays you. One side of your face seems to have given up, drooping in a way that turns your attempt at a smile into a lopsided grimace. It's a chilling, undeniable signal that something is seriously wrong.
Number 8. Arm. Still trying to make sense of what you're seeing, you turn to the kitchen to grab your morning cup of coffee, a ritual you've performed 1,000 times. But when you reach for the mug, your arm refuses to cooperate. It feels heavy, numb, and strangely disconnected, as if it belongs to someone else entirely. You command it to lift, to grasp the handle, but it hangs limp, falling uselessly to your side. This sudden, one-sided weakness is one of the most classic and telling signs of a stroke. Number 9. Speech. Your spouse, seeing your confusion and struggle, asks if you're all right. The answer is screaming inside your head, a clear, panicked, "No, something is terribly wrong." But when you try to force the words out, all that emerges is a frustrating jumble of slurred, nonsensical sounds. Or perhaps, most terrifyingly, you can't form any words at all. The silence is deafening. In that moment, you realize the stroke is not just affecting your body, it's attacking the very core of your ability to communicate, the language center of your brain. Number 10. In all of these scenarios, the most important letter is T for time. If you wake up with any of the symptoms above, your very first thought must be, when was the last time I felt normal? This is called the last known well time. This single piece of information will determine the treatments doctors can use, such as the clot-busting drug TPA. It dictates the future of your brain. When facing a suspected stroke, what you don't do is critically important. Don't go back to sleep. Never think you can just sleep it off. Brain damage is happening in real time. Don't drive yourself to the hospital. Do not let a loved one drive you. Paramedics can begin life-saving care in the ambulance and will alert the hospital to have a stroke team waiting for you. You lose precious minutes by driving yourself. Don't take an aspirin. You don't know if this is a clot-based, ischemic, or a hemorrhagic stroke. Aspirin can make a bleeding stroke fatally worse. A stroke isn't just bad luck. The vast majority of them are entirely preventable. Here is your action plan, starting today. Discuss sleep apnea. If you snore loudly and are often tired, ask your doctor for a sleep study. Know your nighttime numbers. Talk to your doctor about 24-hour ambulatory blood pressure monitoring. Investigate that flutter. Don't ignore heart palpitations or skipped beats. Ask for an EKG. Control what you can control. Manage your diabetes, cholesterol, and maintain a healthy weight. These aren't suggestions, they are imperatives. Continue to watch our videos on early stroke warning signs and how to prevent them on our channel.